Okay, this is the presentation about the population of single parents and the environmental and cultural factors that affect them by Danae Durant and Brianna Dixon-Lee. So health concerns for single parents, this is from the individual presentations. Single parents with multiple children are at a higher risk for health disparities, physical and mental health issues, low income, which can lead to not affording medical care, such as vaccinations, and harm by and to others. Teenage parents are at a higher risk for physical and psychosocial concerns, less educational opportunities, lower income levels, risk for communicable and non-communicable diseases, and a higher risk of harming themselves and others. So for the combined population of single parents, the role of peers plays a very big role. Having supportive friends could provide childcare help, housing, food, transportation, and even financial help with bills. Having supportive friends could also improve the mental health of single parents. Having unsupportive, destructive, or enabling peers could be very harmful for this population and could often be found among teenagers, and which teenagers are more likely to be influenced by peers, and the peer pressure could lead to drug and alcohol consumption. Family support is very beneficial for this population. The benefits of having support could be emotional support, which decreases the risk of mental health disorders, help with childcare if the family lives locally, financial help, and help with transportation or housing. Children of single parents are more likely to have a strained relationship with a parent as well as grandparents and extended family, especially on the side of the parent without custody. So it's very important for the child as well as the parent to receive family support from both parents and from extended family to improve the health outcomes for this child or children. The vulnerability of this population, it's children of single parents are at a higher risk for separation from their spouse in the future, but being a single parent is not passed on through generations. The children of divorced parents are less likely to view marriage as permanent in their own romantic relationships in the future, and children of single parents are more likely to engage in sexual behaviors earlier than peers. This could lead to more teenage pregnancies, which often become single parents. So these behaviors and recurring vulnerability are more likely, mostly as the lifestyle of a single parent and their child and children are less stable physically, financially, and emotionally. But it's not passed on as a genetic. So the legal and political system affecting single parents. So these are some resources that can help. So TANF provides cash assistance to families going through hardships. It goes through the state government, but parents need to apply locally. LIHEAP, they help with energy bills and winterization. Head Start is federally funded childcare for children ages 0 to 5. WIC is nutritional assistance and free screening for pregnant women, and children. And NSLP is free or low-cost school lunches for low-income families. Locally, statewide, and nationally, there are free lawyers and attorneys for single parents and free legal advice as well. There are many government agencies locally, statewide, and nationally that are available to provide assistance and guidance to single parents who have multiple children. The organizations listed above are funded through the national government, which seems to have the best resources that are available to single parents. Free lawyers and free legal advice is also funded by the national government. So potential barriers such as cultural and religious barriers that make this community more vulnerable. Religion, it doesn't really play a role. It can, but mostly if there's just stigmas attached to them, such as the stigma that single parents have to rely on government funding. This puts the individuals at risk for mistreatment, scorn, and judgment, which can amplify their burdens. In some cultures, mainly in East Asia, single parents, especially single mothers, are seen as a burden to society. They can be seen as homewreckers, and sometimes they can be fined for being single mothers. So the international scope, regions in the world in which the population could be in danger or shunned. Like we mentioned earlier, in East Asia, in China, there is a very large emphasis on familial and Confucian values. So single mothers in China face a tremendous amount of stigma for being single and for being a woman. they're seen as home wreckers and they have to pay a large fine. As you can see, so RMB 120,000 and the average salary is 20,000. So that is a huge burden for them. In Japan, single mothers face great cultural shame and are at risk for providing for their families. And working women make 30% less than working men doing the same job. In Korea, society favors a traditional family, and adoptive parents get twice as much financial support from the government than the single parent would get in order to fulfill the traditional family role. So socioeconomic status, over 50% of single parents live in extreme poverty. Single parent families are at high risk of financial burden, which in turn can affect their overall well-being. Socioeconomic status affects people's ability to get health care, and people with low socioeconomic status usually lack insurance. This means that they are less likely to get screening tests, and the diseases and illnesses, when they are found, are at a later stage and they're more expensive to treat or control. Single parents also have an average salary of about 25,500, which in families that have two parents, they have an average salary of 81,500. So that more than doubles. And the annual salary affects the choices people make or are able to make regarding healthcare decisions. And having a low income means parents have to pay for healthcare costs out of their own pockets, which is often much more expensive than having insurance. So race and ethnicity, how it affects health outcomes in this population. Within 30 years, minority populations, which already make up most of the population in some cities and states, such as California, will become the majority nationwide. For racial and ethnic minorities in the United States, health disparities take on many forms, including higher rates of chronic disease and premature death compared to the rates among whites. People of color receive less medical intervention for pain and cardiovascular care. Women of color have higher mortality rates during and after pregnancy. Infant mortality rates are higher among ethnic and non-Caucasian groups. And heart disease and cancer are the leading causes of death across racial and ethnic groups. So religion, religious beliefs and values may influence health behaviors, but it has been found that discrimination does not exist relating to health outcomes. Religion had little to no effect on health outcomes of single parents. The findings conclude that there is little reason to believe that religion or non-religion plays a major positive or negative role in health outcomes across the life course. So gender affects health outcomes within this population as well. So most children who live in a single parent household are usually living in a household which is headed by a single mother. There are 9 million single mothers and 2 million single fathers in the United States. Females have a higher prevalence of mental distress and depression, while males have a higher suicide rate. Men are more physically active than women, and being physically active can prevent or delay the onset of many chronic diseases. Men tend to drink and smoke more excessively than women, which can cause health problems. Women tend to receive less medical intervention for pain management and cardiovascular care, and research suggests that women patients are more likely to receive less effective care than men patients. So geographical location affecting health outcomes. So geographical location affects access to resources, employment, and childcare for single parents, which is the biggest factor in that. Living in an urban area could allow resources to be more available while also decreasing transportation costs and commute time. Rural areas could decrease health outcomes due to lack of transportation, family living far away, and social isolation. Telehealth and telemedicine could improve access to healthcare, but there would still be concerns for childcare, employment, and social isolation. But the healthcare outcomes could be improved with the access to telehealth and telemedicine. So, health disparities bias, implicit and explicit biases. Implicit biases are unconscious biases that you have against people. So single parents could face prejudice from neighbors, landlord, employers, family members. An example could be employers avoiding giving a single parent more work or not giving them a promotion because of this subconscious bias that they think they wouldn't be able to get the work done or they wouldn't have time to do it. So explicit biases, single parents could face, as we mentioned earlier, they could be shunned, such as in areas in East Asia. Family members could use hateful speech, especially during teen pregnancies, when they're single parents and teen pregnancies. And cultural acceptance of divorce has improved in the last few decades, but older generations in some areas of the world, as we mentioned earlier, still have prejudices against divorce and especially against single mothers. So the international scope, areas of the world in which these disparities could have less influence. These disparities could be lessened in countries which have universal health care, as single parents could be unemployed or not afford health insurance. So living in a country that has universal health care could drastically improve the health outcomes for these individuals. And according to Fox Business, the 10 best places to live in the U.S. for single parents, taking into account factors such as housing, childcare costs, commute time, and among other factors. So these include Naples, Florida, Huntsville, Alabama, Omaha, Nebraska, Raleigh, North Carolina, Wichita, Kansas, Little Rock, Arkansas, Asheville, North Carolina, Austin, Texas, Lansing, Michigan, and Ann Arbor, Michigan. Many of these are cities that parents can receive the help that they need financially, with childcare, less commute time, and good housing. So having these factors can play a big role in the health outcomes of single parents. And these are our references, more continued, and there's the last one. Thank you for joining us for this, for our single parents population, environment, and cultural factors.